Yes, well, pathogens have always been around, and we know in our history about epidemics and the benefits of penicillin and the antibiotics that have been designed as far as treating acute pathogens. So um, we now have a wider variety of pathogens that people are experiencing symptoms from these days with various viruses and bacteria and spirochetes. And I think we're beginning to realize that antibiotics are have been a very important discovery, and yet there are issues that are rising out of the abuse or overuse of these antibiotics. So we all have pathogens in our system, and yet we remain asymptomatic for many of us, and yet other people have the same pathogens, and yet they're ill. And what's the reason for that? So it may be that the population of a pathogen has become high to the extent that it now causes symptoms, or a weakened immune system that is not able to control the pathogen. So what would be the approach? One is certainly to reduce the pathogens, and there's different sort of natural therapies that accomplish that, very effective natural therapies that accomplish that, and we use a couple here in our clinic. The other is to improve and support the immune system, which in part is our white blood cell count and the activity of our white blood cells. There's another area of treatment for pathogens, which was done in the 1920s and 30s, which had to do with what were called bacteriophages. And these are well recognized in research. These are viruses that are in our ecology, in the ocean, in our soil. And it is estimated that there are more of these phages than there are bacteria, which help to maintain an equilibrium in nature. We have these phages within us as well, which is part of our immunological system. I believe that part of the issue is that some people are deficient or they have inadequate numbers of these phages in their system. It's a little complicated, but I'll give it a try. So phages are extremely small, a virus compared to a bacteria, and their intelligence attaches themselves to their corresponding pathogen, injecting their contents inside what has now become their host, and they will, using the innards or the contents of the pathogen, they will use that to replicate themselves. And within a very short period of time, they will start excreting enzymes that will break apart the membrane of that host, and out come lots of these phages, which then go on to find other hosts, other similar pathogens, and begin to replicate themselves and to get the pathogen down to acceptable levels so there's no more symptoms. So it's a fine balance within the body, and I do believe that phage therapy, which is having now a renaissance in the last 10 to 15 years, a couple of clinics, one is in Poland and one is in Georgia and Russia, are continuing research and also have been doing treatments primarily for those individuals who have developed resistant strains of bacteria, and no antibiotics are able to control the infection. And part of I believe their mandate is that they must only treat those individuals who are no longer treatable by modern medicine, antibiotics. And having amazing results. So we are instituting that phage therapy using cultured foods and preparing them in a certain way so they are rich in these phages, and also using a seawater product from France, which is also rich in phages. So the idea then is that all people have various pathogens in their system. It is said that 80% of people with the Lyme spirochete do not express symptoms, and only 20% of them do. So something has happened to their immune system that they cannot keep the population of Lyme spirochetes at a level which which would produce symptoms. So that's my slant on pathogens. I'll also include mold as another pathogen, and I think partly because of how our homes are well insulated and recycling air and the buildup of different chemicals in our household, but also if there is a damp area of the home which has mold in it, those spores are circulated throughout the house and causing illness and weakness and chronic fatigue, etc. So the approach to treating mold issues is similar to any kind of pathogen, which is intravenous work, using ultraviolet light to treat the blood, and also just sometimes the ozone, which both of those will reduce or kill off mold within the blood. And as long as the person is living in a mold-free environment, also undergoing the different purification therapies to get the dead mold and the residues out of the body is pretty much our approach to pathogens.